Hello, boys and girls. This is Tim Ferriss, and welcome to another episode of The Tim Ferriss Show, where it is my job to deconstruct world-class performers of all different types across every possible discipline. This episode, we have a scientist who is also incredibly good at teaching. Dr. Martin Kabbalah, or Martin Kabbalah, PhD, is a professor and chair of the kinesiology department at McMaster University in Hamilton, Ontario. His research on the physiological and health benefits of high-intensity interval training, or HIIT, has attracted incredible scientific attention and worldwide media coverage. He is the co-author of the brand new book, The 1 Minute Workout. And that may sound ridiculous, but by the end of this episode, you will not think it's ridiculous. You will think that it is entirely scientifically supported. I've read that you've said before, if you had to choose one exercise, you would choose the burpee. I'm a big fan of burpees. I've done a lot of burpees in my life, from wrestling and jiu-jitsu and so on. But A, do you still feel that way? And B, I've read that you, in resistance training, in the resistance training that you do, you train to failure, but you'll do cycles, so you have 3 sets to failure of each exercise. So I'd be curious to know, so A, do you still feel that way about the burpees? And then B, why 3 sets to failure as opposed to 1 or 2?
I do feel that way about the burpee. And, let's frame the question here. And the question that I received was, what is the single best exercise? Which really means, if you were only restricted to one exercise, what would you do and why? And it's hard to fathom the question.
For sure.
I would pick the burpee because, number one, it requires no specialized equipment. It's a body weight style movement, so you can do them anywhere. Number two, it's going to build both strength and cardiorespiratory fitness. So if you do burpee sets, obviously you're going to have some push-up motion in there. You're going to have some leg strength development. But if you're doing burpee sets, and it goes to the second part of your question, I guess, why would you do 3 sets? Because I think applying burpees in an interval manner and doing a couple of sets of them allow you to keep the heart rate up, which is going to provide the cardiovascular training. So I would stick with the burpees. It can be done anywhere. And if you do burpee sets, it provides both a cardiorespiratory boost as well as a strength boost. I think I also said at the time when I was asked the question, I don't really see anyone ever sticking with a burpee workout over time, because let's face it, burpees suck. Burpees are really hard to do. But if I could give a shout out to this individual who contacted me, his name's Josh Spodek. He lives in Manhattan. He's PhD in astrophysics. He's got an MBA. And he contacted me to say, I read that piece in the New York Times and I sort of took it up as a challenge. And I've been doing burpees every day for 5 years. And, it's basically become his go-to exercise. So clearly some individuals could keep it as their sort of go-to exercise. So good on you, Josh. I certainly couldn't keep that up, even though I said it would be my go-to exercise.
Yeah, burpees, I wouldn't give them a very high ranking in the physical recreation category for sure.
If I could just make a comment too, Tim, I just said burpees suck, they hurt. This is something around interval training where there's definitely very visceral reactions around the potential translatability. My colleagues who are in the exercise and health psychology area, who talk about things like mood, affect, motivation, long-term adherence, there's a real visceral debate going on right now around the potential long-term translatability of interval training. Clearly, I'm someone who is in the camp of, yes, I think this is very much a viable public health strategy. Certain types of interval training are highly suited for many different individuals. And again, it goes back to this idea that people think interval training only means extreme style training. But there's a large segment, or there's certainly an opinion out there that this is not a viable public health strategy at all. I happen to disagree with that, because I think the more menu options we can give people, the more exercise choices, the better. Just get out there and do it. Or, you know what? If you don't have a 45-minute block of time to work out, that's okay. Build intervals or build exercise, build movement into your life, because we really, really need that. And, you look at the profound influences that could have in terms of boosting health, lowering healthcare costs. When I talk to my students, it's about where could all of that money that we're otherwise spending on drugs and pills go? Well, we could use that investments in other places to better support people. But this notion of exercise is medicine, it's absolutely true. Exercise is the best medicine. It has so few side effects associated with it, but the benefit that we can get from it is tremendous. And I think some people are afraid of exercise, or, obviously the number one cited barrier for why people don't exercise is lack of time or perceived lack of time. And people have it in their heads that if I don't have this big block of time to exercise, it's not worth it, or they blow it off. And so if there's a message, it's really no. Time efficiency, we understand, is important, but even if you have a 10-minute period of time in the day, get out there, move. Intervals provide an extremely effective way to build time-efficient exercise into your day. The benefits of that are profound. Don't think of it as you need to exercise to lose weight, and that's what confers health. As we've been talking about, there's a direct line there between exercise, boosting your cardiorespiratory fitness, lowering your risk of dying, lowering your risk of developing many of these chronic conditions.
Marty, where can people learn more about you, find you, the book, say hello on social media, or whatever you would like to mention?
I'm on Twitter, Gibala M, at Gibala M. The book will be published by Penguin Random House. It will be out on February 7th. You can pre-order now from all of the usual booksellers.
Anything else that you would like to say or request to the audience?
Life is an interval workout.
Ooh,
maybe that's
the
way to go. Maybe that's the name of the next book. No, obviously I'm big on exercise. I really appreciate this opportunity to talk to you a little bit about that. Exercise is fantastic. And if we could just get more people moving, the enormous impact and benefit that would have on public health.
Agreed. And personal health, which is what it starts with. Marty, thank you so much for the time. I really appreciate it.